So good morning, ma'am. I am Ria Standard 5 and I am a nurse student from Asian College of Technology and I will take care of you from day shift. For safety purposes, ma'am, may I hold your ID band as I to identify you. So what's your name, ma'am? Can you please dictate it for me? And how old are you?
21 years old.
Okay, and your date of birth?
April 7, 2001.
Okay, so I am here to assess your breast, your jugular veins, your heart, and so on. So I've already closed the curtains behind us and I already closed the door also to provide privacy to my client now. And also I am going to perform hand hygiene. Okay, before we start, ma'am, I am going to wear my gloves. Is that okay with you? Just for a moment, please. So as you can see, I've already wear my gloves and now I am going to perform a general appearance inspection for breast size, shape, and symmetry in static position. As you can see, my patient here is now sitting beside me. So for normal findings for general appearance, inspect scan for localized discolorations or hyperpigmentation, increased vascularity, retraction, or dimpling. So for female, rounded shape, equal, and most likely unequal in size, generally symmetric. But for as a female, most are even with the chest wall, morbid, obese, may be similar with female breast. So as normal findings for general appearance, skin is intact and uniform in color, which is all of the skin color is the same. Light skin people, visible, diffuse, symmetric horizontal or vertical vascular pattern. Maybe have moles or navy. So now I am going to inspect my patient's areola. So inspecting for patient's areola, it may be to inspect the size, shape, symmetry, color, visible lesions, and mass. So, while inspecting my patient's areola, bilaterally the same, round or oval, pink, and no discharge, which is above normal. So now I am going to inspect my patient's navel. While inspecting your patient's navel, you are going to inspect for size, shape, symmetry, color, and visible lesions and mass. And when you are going to, of course, you are going to palpate the brains, areola, and the masses underneath and discharge. There are 3 techniques when palpating your patient's breast. First, circular motion. Second, wedge, which is something like I am going to attach photo for you to see. And third is vertical strip. Okay. Bilaterally the same, round, everted, some age and inverted, no discharge, most are darker compared to areola. No tenderness, no lumps or masses, no gills or discharge. Lower edge of breast may feel firm and hard, warm to touch and smooth. So now I am going to examine my patient's heart. So while examining patient's heart is usually performed while the client is in a semi-reclined position. The practitioner usually stands at the client's right side and auscultates and palpates with the right hand. But this may be reversed if the nurse is left-handed or left-handed. So when examining heart of the patient, we are going to inspect for any pulsations or anterior chest over heart. To inspect your to be normal. So the second thing that we needed to do is going to palpate for any pulsations or the apical impulse. Do you feel any pain, ma'am? What about here? Okay, here. What about this one? Okay, so the next thing to do is I am going to auscultate the heart rate and rhythm of my patient. So now I am going to auscultate the heart rate and rhythm of my patient. Finding visible in the mitral area, 4th to 5th intercostal space, orthic area, no pulsation, pulmonic area, no pulsation, apical area, pulsation is palpable, epigastric, not palpable. Before auscultation, 2 heart sounds are audible in all areas but loudest at apical area. No more mole, trill, and hay. So now I am going to inspect the jugular veins of my patient. Inspecting jugular veins for distension while the client is placed in the semi-Fowler's position, 15 to 45-degree angle, with the head supported on a small pillow. So now I am going to inspect the jugular veins of my patient. Some jugular veins may be visible, some others will be invisible, which is normal. So if jugular distension is present, assess the jugular venous pressure. So as per my patient, there is no jugular distension. So locating the highest visible point of distension of the normal internal jugular vein. Although either the internal or the external jugular vein can be used, the internal jugular vein is more reliable. Measure the vertical height of this point in centimeters from the sternal angle, the point at which the clavicles meet. Repeat the preceding steps on the other side. So now I am going to measure the vertical height of this point in centimeters from the sternal angle, the point at which is the clavicles meet. Okay. So the jugular veins, the external jugular veins is more easily affected by obstruction or kinking at the base of the neck. So now I am going to perform anterior and posterior thorax. For general appearance, I am going to inspect the skin color, presence of hair, moles, bones, skin breakage, or scars. So for normal findings of anterior and posterior thorax, it may be varies from light to dark skin, generally uniform except in areas frequently exposed to the sun, no wounds or skin breakage. So now I am going to inspect my patient's posture and shape of thorax. While inspecting, I am going to inspect for size, shape, and symmetry. So while inspecting for the posture and shape of thorax of my patient, it is a good posture. Thorax is dome shape and symmetric. APD and TD is in ratio. Color even and is consistent with color of face. So now I am going to palpate the exterior thorax of my patient. Do you feel any pain, ma'am? No. What about this one? Can you please inhale? Exhale. Again, inhale. Exhale. Okay. So, the findings of palpating my patient's and exterior thorax, no lumps, mass, or area of tenderness. So the next thing that I am going to observe is the scapula or sternum. I am going to observe for symmetry and pulsation. So as I observe here, it's all normal. There's nothing to worry about. And the next thing to do that I'm going to perform for her is to palpate the skin and tissue over the scapula for signs of swelling or tenderness and signs of dislocated bones. Do you feel any pain now? What about this one? Okay. Here. So for palpating the scapula of my patient, symmetric, not protruding, shoulder and scapula are at equal horizontal position. So no signs of tenderness and bone dislocation. So now I am going to assess intercostal space and movement. I am going to assess symmetry and movement upon breathing. Note any bulging or retraction, bone protrusion, or dislocation. Okay, ma'am, can you please inhale for me? Exhale. Again. Exhale. Okay. So normal findings for inspection, symmetrical movement as the client breathes, no bulging or retraction, protrusion, or displacement. Now I am going to perform rib symmetry, structure, and movement of my patients here. Note for symmetry of the thorax from posterior and lateral views, rib structure, and movement. So ma'am, can you please inhale for me? Exhale. Inhale. Exhale. Do you feel any pain here? Okay. So normal findings for inspection or inspecting my patient's rib symmetry, structure, and movement. It is symmetrical. Ribs are sloping downward at approximately 45-degree angle. AP diameter versus transverse diameter is 1:2 ratio. So while assessing rib symmetry, this assessment helps to detect deformities such as barrel chest. Normally, the AP is less than transverse diameter, 1:2 ratio. So now I am going to get the temperature of my patient here. I am going to palpate the skin over posterior thorax. And I am going to loosen down my gloves as I am going to palpate the skin of my patient to determine the temperature. Okay, normal findings. Uniform temperature, skin is intact, slightly warm to touch. So now I am going to perform scan trigger. I am going to pinch the this back of the hands of my patients here. Can I do it, ma'am? Okay. As I pinch the back of the hand of my patient, normal findings, good skin trigger, skin fold returns to its original appearance within 2 seconds or less. So now I am going to perform the spinal alignment of my patient here. Note, position and alignment. I am going to palpate for signs of discontinuity or dumpling of my patient's spinal. Do you feel any pain, ma'am? Normal findings. Spinal column is straight. Right and left shoulders, hips are at the same height. Spinal vertebrae are aligned. Normal curvature of the spine, vertically aligned and straight. So now I am going to perform the chest excursion of my patient here. I am going to inspect and palpate posterior chest for respiratory excursion, thoracic expansion. Inhale, ma'am. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Normal findings. Full and symmetric chest excursion. Thumb normally separate 3 to 5 centimeters. So now I am going to assess tactile femtus. I am going to palpate and assess the chest of the for tactile or perceptible vibration felt through the chest. And I am going to do it also for vocal femtus. I am going to auscultate the femtus later on. So now I am going to palpate now. Mom, can you please say 99 while I am counting?
99, 99, 99, 99, 99, 99.
Okay. Again.
99, 99, 99, 99, 99.
Okay. And I am going to do it also in front. Can you please dictate 99, ma'am?
99, 99, 99, 99.
Again.
99, 99, 99.
Okay. So, as I am palpating my patient, normal findings, symmetric, decrease over heart and breast tissue. Femtus is most prominent between scapulae and decreases as you progress down. Assessing tactile femtus provides information about the density of the lines through vibratory sensation, increase over consolidated areas such as in pneumonia. So now I am going to perform breath sounds. I am going to auscultate posterior thorax using the flat disc of my diaphragm of the stethoscope. Normal findings, normal breath sounds, tracheal, harsh, high-pitch, bronchial, loud, high-pitch, bronchovascular, medium in loudness, and speech over the bronchos. Vascular, soft, low pitch, heard over lung periphery. So now I am going to perform chest wall percussion notes, determine whether the lung tissue is filled with air, liquid, or solid. Locate the needed posterior thoracic landmarks. normal finding resonates except over the scapula, flat over scapula and rib bones, dull over liver. So I am going to observe skin color of the abdomen, vascularity contour, note for presence of striae, scars, lesions. So normal findings, inspection, skin is unblemished, there is no scars, it is just smooth, abdomen is free of lesion, flat or raised brown nose, may be visible, flat, rounded or scaphoid. Inspect umbilicus for color, location, contour, inspection for normal findings. Umbilicus is concave, pulsation midway between epigastric and xiphoid process. The color is same as the surrounding skin color, and abdominal circumference 56 centimeters. So now I am going to auscultate bowel sounds. I'm going to do it circular motion. So normal findings, auscultation, bore rhythm of 21 per minute. So now I am going to palpate the abdomen of my patient. Do you feel any pain, ma'am? As I touch it, do you feel any pain? Okay, here? How about this? This one. So as I palpate the abdomen of my patient, the abdomen, hard abdomen, no muscles, and area of tenderness. So now I am done doing assessment of my patient's venous valvaria, and I am going now to remove my gloves. I am going to perform hand hygiene. So that's all